This is my review of the muscles in the lower leg. So the lower leg muscles can be divided into three main parts: the anterior compartment in front, the lateral compartment on the side, and the posterior compartment behind. The posterior compartment can be further divided into the superficial muscles on the surface and the deep muscles underneath it. So the main nerves in the lower leg are the deep fibular nerve, which innervates the anterior compartment, the superficial fibular nerve, which innervates the lateral compartment, and then the tibial nerve, which innervates the posterior compartment. So the main functions of the lower leg are to move the foot, and so the first main function would be dorsiflexion, which is done by the anterior compartment. Dorsiflexion is lifting the foot up, and the opposite, moving the ankle down. Plantar flexion would be done by the posterior compartment. And the lateral compartment also contributes weakly to it because we'll see later on the tendons of the lateral compartment attach underneath to the plantar side of the foot. And two other functions of the muscles in the lower leg are inversion, which is when you bring your big toe in medially. And this is mainly done by the tibialis group, so the tibialis anterior and posterior. We also have the opposite, eversion, where you bring your pinky toe outwards laterally. And this is done by the fibularis group, the fibularis longus, brevis, and tertius. And lastly, we have a special function, the popliteus, on the posterior compartment, and this is used to unlock the knee during knee flexion. So let's look at the muscles in the anterior compartment. Before we begin, we have two main bones in the lower leg. So we have the tibia on the medial side, and then the smaller, thinner fibula on the lateral side. So our first muscle here, the tibialis anterior, has its proximal attachment to the lateral condyle of the tibia, the superior lateral side of the tibia, and also the interosseous membrane between the tibia and fibula. And then it runs down and crosses over to its distal attachment here between the medial cuneiform and the base of the first metatarsal. So the action of the tibialis anterior is to dorsiflex the foot because it is attached to the top of the foot, and it also helps with inversion because of how the tendon runs diagonally like this. So the next muscle we have is the extensor digitorum longus, and just like the name suggests, it extends the digits of the foot. So we have, for its proximal attachment, we have the lateral condyle of the tibia, and also the superior and medial side of the fibula. And then it runs down here and branches off to attach to the middle and distal phalanges of the four toes. Right next to it, we have the smaller extensor hallucis longus, and this one attaches to the front of the fibula at the middle part. And you can see, compared to the digitorum longus, it attaches more distally or lower on the leg. And then it runs down and attaches to the distal phalanx bone of the big toe. And so similarly, it's kind of in the name, the extensor hallucis longus extends the big toe, and hallucis just means big toe. And the last muscle we have in the anterior compartment is the fibularis tertius. This one is a rather small muscle. It attaches to the front of the fibula and runs down and attaches to the top of the base of the fifth metatarsal bone right here. And what this muscle does is, because it's part of the fibularis group, it helps evert the leg, and it also weakly helps with dorsiflexion because it is attached to the top of the foot. Next, let's look at the lateral compartment of the lower leg. So the first muscle is the fibularis longus. It attaches to the lateral side of the fibula and the top 2/3. It runs down underneath the foot and then attaches to the base of the first metatarsal and the medial cuneiform. And from its attachment point, we can see that the fibularis longus will help with plantar flexion because it runs underneath the foot. But the main function of the fibularis longus is for eversion, to bring the foot or rotate the foot outwards laterally. Next, we have the fibularis brevis. It also attaches, its proximal attachment is also on the lateral side of the fibula, but more inferiorly compared to the longus. And then it runs down here and distally attaches to the tuberosity of the fifth metatarsal. And its action is also to evert the foot. Now let's look at the posterior compartment of the lower leg. So most superficially, we have the gastrocnemius. The lateral head of the gastrocnemius attaches to the lateral aspect of the lateral condyle of the femur, while the medial head attaches to the popliteal surface, superior to the medial condyle of the femur. And then it runs down via the calcaneal tendon and attaches to the posterior surface of the calcaneus. So because of how the gastrocnemius crosses the knee joint and attaches to the femur, it has multiple functions. So the first function is to plantar flex the ankle, but this is only when the knee is extended. The second function is to flex the knee, and the third function is to raise the heel while walking. So you can think of it like a tiptoe action. Next, we have the soleus, which is underneath the gastrocnemius. So the soleus attaches to the soleal line of the tibia and also the proximal fibula. And the one main thing to note is that there's a tendinous arch between the tibia and fibula. So you can see here, there is no tendon at this part, and instead there's a hole here. And the reason for that is for structures like arteries to pass through. And then distally, it attaches to the posterior surface of the calcaneus via the calcaneal tendon. And this is the same for all three superficial muscles of the lower leg. So the action of the soleus is to plantar flex the ankle regardless of the knee position, because it doesn't cross the knee joint. So it is not affected by the knee position. And it also helps prevent excessive inversion or eversion. So it stabilizes the leg on top of the foot. And lastly, here we have the plantaris. This attaches to the lateral supracondyle line of the femur, right here. And then it runs down and attaches, distally to the same calcaneal tendon and then to the posterior surface of the calcaneus. And what the plantaris does is it just helps the gastrocnemius in plantar flexion. But you can see because the muscle is quite small, it is not a main muscle used in plantar flexion, so it weakly assists in doing so. Last, let's look at the deep muscles of the posterior compartment of the lower leg. So the first muscle here is the popliteus. It attaches proximally to the lateral condyle of the femur and the lateral meniscus, and then runs inferiorly and medially to attach to the posterior surface of the tibia, superior to the soleal line. The main function of the popliteus is to unlock the knee for knee flexion. This is important because when the knee is fully extended, the condyles of the femur fit into the concave plateaus of the tibia. So if you don't unlock this joint, then the knee cannot continue with knee flexion. The secondary function of the popliteus is for knee flexion because of how it runs across the knee joint. Next, let's look at the flexor hallucis longus. So this muscle attaches to the inferior part of the interosseous membrane and the inferior 2/3 of the back of the fibula, the posterior surface. And then it runs down and attaches to the base of the distal phalanx of the big toe. And the main function of this muscle is to flex the big toe, and it also helps with plantar flexion. Alright, next let's look at the flexor digitorum longus. So this muscle attaches to the tibia, to the tibia inferior to the soleal line on the medial posterior surface. And then it runs down and attaches to the base of the distal phalanges of the four toes. And the main function of this muscle is to flex the four toes. And again, it helps with plantar flexion. Oh, one thing I forgot to mention is that the flexor digitorum longus helps support the longitudinal arch of the foot, while the flexor hallucis longus helps support the medial arch of the foot. And lastly, we have the tibialis posterior. So proximally, it attaches to the interosseous membrane and to the tibia inferior to the soleal line, and also the posterior surface of the fibula. And then it runs down and attaches to multiple has multiple distal attachments, including the base of the second, third, and fourth metatarsal, the cuneiform, the cuboid, the tuberosity of the navicular, and then also the medial protrusion of the calcaneus over here. So the main function of the tibialis posterior is for ankle plantar flexion and also for inversion, to bring the big toe inwards. So one thing I wanted to add is a mnemonic to remember the tendons on the posterior side of the lower leg. So if we start in the medial malleolus here, which is a landmark on the tibia, the mnemonic we can use is Tom, Dick, and very naughty Henry. So Tom refers to the tendon of the tibialis posterior. Dick refers to digitorum, so the flexor digitorum longus. And very naughty refers to the posterior tibial artery and posterior tibial vein, as well as the tibial nerve that passes through between here, but not shown here. And lastly, Henry refers to hallucis, so the flexor hallucis longus.